Austin Public Health gave its first media briefing on monkeypox today. Right now, there are 9 confirmed cases in Travis County, along with several presumed cases. Dr. Mike Stefanovich with a Community Care contributed to that briefing today. He joins us now to talk more about this. Thank you so much for getting over here to talk to us. We really appreciate it, Doctor.
Thank you very much, Jennifer. It's a pleasure to be with you
Th-
all.
Thank you. Thank you. So have you treated anyone with the virus, and what do Central Texans really need to know about this? Are people getting really sick? What are you seeing?
Yes. So personally, at the David Powell Clinic, which is one clinic that is part of our broader umbrella at Community Care, we generally care for many people living with HIV, as well as plenty of members of the LGBTQ plus community here in Austin, Texas. And I can tell you, we've cared for, diagnosed approximately half of the existing cases here in the county. So what we've seen actually in the vast majority of these individuals is really a rash, a rash that's really considered just a few small bumps. The big thing for people to know is it's generally not very similar to the textbook or Google images that you'll see on the internet. These are generally tend to be a few very small bumps, perhaps on the hands, the face, the back, the abdomen, sometimes on the anogenital area as well. And so they start out as small bumps that can grow into what look like whiteheads here. Fortunately, we tend to see very mild cases here in the county, and that's been reflective of what we've seen nationally here in the U.S. as well. We have not had to send anyone to the hospital from my clinic for a case of monkeypox to date here, and they tend to be what we call self-limited, meaning they usually resolve on their own after several weeks without treatment.
Good to know. So we have many people asking, we've gotten a lot of questions into our newsroom about the spread of monkeypox. One of those questions that we got was, could it be spread by a handshake? Can you explain community spread and how people can actually contract this?
Great question. So I understand there's a lot of concern in the community as far as how this is transmitted. And I do want to set the tone that monkeypox is not the coronavirus. While we may draw some parallels there between monkeypox and COVID-19, just because the community at large is very familiar with COVID-19 over the last 3 years, they are very different entities. And so how it's been spread so far with monkeypox is really close, intimate skin-to-skin contact, protracted skin-to-skin contact, usually between sexual partners, actually, and new partners at that. And so this is, while we're still understanding this virus and we're still learning new information from week to week, I do want to reassure people that oftentimes it requires close skin-to-skin contact or close contact with respiratory droplets for a protracted period of time here. This is generally not something that you're going to get from somebody in the grocery store, so to speak. But I do think it's all important for all of us to access accurate, verifiable sources of information so we can educate ourselves and remain vigilant.
Thank you, Doctor, for shedding light on that. Lastly, how soon do people see the symptoms, and are vaccines available right now for anyone who wants one?
Great questions. So as far as the symptoms go, it can be a little tricky. And this is the challenge for monkeypox here, both locally and globally, is that the symptoms usually don't start out with a rash. Oftentimes what we've seen locally here is about 50% of cases, people start out noticing perhaps some fevers, some muscle aches, perhaps a sore throat, some swollen glands, swollen lymph nodes as well. And that is oftentimes followed about perhaps 7 to 10 or 14 days later with a rash, actually. And that's the rash that I had mentioned already. To the latter part of your question, with respect to vaccines, I will defer to Austin Public Health as the public health authority here with regards to a strategic plan on vaccinating individuals who are at risk of acquiring monkeypox. I will say, and this came up in the press conference that we were attending a few minutes prior, per Dr. Desmar Walks, there is a strategy in place at the CDC to vaccinate exposures, those who are at high risk of developing monkeypox and who were potentially were exposed to confirmed cases of monkeypox. And so that's a very limited number of individuals. but it is an evolving situation. And so I would defer people to Austin Public Health's website as well as the CDC for more information.
Thank you so much, Dr. Mike Stefanovich. Thank you for just shedding light and providing some insights on this. You are with Community Care. We appreciate you for spending time with us today.